Have you ever stopped to think maybe the secret to a longer life isn't just what you, but how you? Or perhaps, whether that medicine you count on is really just a few clicks away, safe and sound no matter where it actually comes from. Welcome to the Deep Dive. We're here to cut all that noise and hope that give you those aha moments. Today, we're taking a good look at the key insights from the Consumers 360 News commentary for June 22nd, 2025, pulling from the great aggregation over at consumers.app. Our goal, really, is to give you a shortcut to being genuinely well-informed on some pretty crucial consumer trends. We'll mix surprising facts with practical insights. Let's jump in. Okay, so to kick us off, let's unpack this headline. It definitely makes you pause. Thanks to imported drugs, America has lost control of its medicine cabinet. That's from The Hill on MSN.com. Wow, that sounds incredibly serious. It raises questions right away about availability and, safety too, doesn't it?
It absolutely does. And the research available through consumers.app, it really highlights some hidden complexities here. What's striking isn't just that shortages happen, but how fragile the pharmaceutical supply chain actually is. We're often talking about a lack of redundancy. If one specific factory, maybe somewhere far away, making one key ingredient.
Right, just one link.
Exactly. If it faces a disruption, or maybe there's a sudden export ban from a country you weren't even thinking about, that can leave pharmacy shelves empty right here. That's the vulnerability we don't often see.
So it's more than just getting a drug on the shelf. It's this whole invisible journey it takes, and international politics are all tangled up in it. What happens when these drugs come from places with, say, different rules or oversight?
That's a really critical point. Relying heavily on imported drugs means we inherently deal with varying regulatory standards, different countries, different rules, and that, unfortunately, can open the door for medicines with inconsistent quality or even safety problems to enter our market. Think about it. If a drug isn't made under the same strict controls we expect, its effectiveness or safety could be compromised. Mm-hmm. And beyond just the quality control aspect, you've got global events, geopolitical tensions, sudden export bans. These can seriously disrupt supply chains. That directly causes the shortages we sometimes see. It really underlines why we need robust quality checks, yes, but also truly diversified supply chains. Multiple suppliers, different production sites. That's how you build resilience for safety and availability.
And it's not just about whether the medicine is there or even if it's safe. For so many people, the biggest issue is just affording it.
Oh, that's a huge piece of this puzzle, especially here in the U.S. The numbers are pretty stark. Nearly 1 in 4 Americans says they have real difficulty affording their prescriptions. And maybe even more shocking, about 30% admit they've skipped doses or, rationed their medications simply because of the cost. That has serious health risks.
Wow, 30%.
Yeah, and the reasons behind it are complex. You've got patent protections, limiting cheaper generics, a lack of negotiating power for big insurance programs. It's a systemic thing that really impacts daily health choices for millions.
So, if you're listening, what this means for you, really, is that your health access isn't just about your doctor's prescription pad. It's tied into this incredibly complex, often hidden global network of manufacturing, trade, economics, politics. Understanding that bigger picture, it helps us appreciate the challenge of making sure essential medicines are available, safe, and affordable for everyone. Okay, let's shift gears now from global supply chains to something much more personal, but just as important for our well-being. We're moving into longevity, and here's a headline from Rolling Out that really caught my eye. 9 powerful ways strength training extends your lifespan. This isn't just about looking fit, is it? It sounds like there's much more to it.
Absolutely not just about looks. The research is quite compelling, actually. Strength training is a surprisingly powerful tool for longevity. Often overlooked, maybe. Beyond just building muscle, you can see, it fundamentally recalibrates your body's internal workings. For example, resistance exercises. They actively stimulate muscle growth, yes, but they also significantly boost bone mineral density.
Okay, stronger bones.
Exactly. And that's crucial as we get older. It dramatically cuts the risk of things like osteoporosis and fractures, which directly helps you maintain mobility and independence later in life.
So it keeps our whole structure, our framework, stronger? But what about the internal stuff, the benefits we might not see?
Right. And that's where it gets really interesting from a health perspective. Strength training is vital for metabolic health. By increasing your muscle mass, you're not just stronger, you're making your body much better at handling glucose, improving insulin sensitivity. This acts like a shield against chronic diseases, particularly type 2 diabetes. It lowers your risk significantly, and that contributes directly to a longer, healthier life. It also helps reduce risks for cardiovascular disease, even some cancers, by improving your overall metabolic rate.
That's quite a list of physical pluses. But does strengthening the body do anything for the mind?
Without a doubt. The impact on mental health is pretty profound, too. Regular strength training can significantly lessen symptoms of anxiety and depression. It boosts mood, promotes better sleep, and improved mental well-being contributes to a higher quality of life, which, indirectly extends longevity by reducing chronic stress and mental health burdens. For older adults especially, this is huge. Maintaining muscle, improving balance, bone density, it all helps prevent falls and keeps them active.
So this really poses a question for you listening. Are you getting enough strength training? It really seems like it's way beyond just aesthetics. It's a fundamental investment in extending and, frankly, improving your life, body, and mind. Let's stick with personal health for a moment, with a related topic that's often maybe misunderstood. This headline from CNN International certainly grabbed you. Deep belly fat triggers inflammation. Here's how to reduce it. Most of us know excess fat isn't ideal, but what makes this specific kind of fat, this deep belly fat, so bad?
It's a really important distinction. When we talk about deep belly fat, we mean visceral fat. That's the fat packed around your internal organs, like your liver, your intestines. It's different from the subcutaneous fat just under the skin. What makes visceral fat so harmful is that it's metabolically active. It doesn't just sit there passively. It actively produces these pro-inflammatory markers, chemicals called adipokines. They basically fuel low-grade chronic inflammation throughout your body. And this chronic inflammation is a key driver behind serious stuff like heart disease, Alzheimer's, and metabolic problems like type 2 diabetes.
So it's not just the amount of fat, but where it is and what it's doing biochemically. That's the danger. How do we even know if we have too much of it, especially if it's hidden away like that?
That's been tricky, yeah. But detection is getting better. Things like waist circumference give you a clue, sure. But medical imaging, like CT or MRI scans, they give precise measurements. And what's really innovative now is using technology like deep learning models. They can assess fat around the heart called pericardial fat just from a standard chest x-ray sometimes. That's a potential game changer for spotting heart disease risk earlier.
Wow, from an x-ray.
Yeah. And we're also learning more about specific hormones, like one called FGF21. It seems to improve metabolism and might even help treat metabolic syndrome by directly targeting and reducing that harmful visceral fat inflammation, improving insulin sensitivity too.
That's fascinating. Both detection and maybe future treatments. But for right now, for people wanting to take action, what actually works? What are the practical ways to reduce it?
Well, the good news is the effective strategies are pretty straightforward and they work together. Research consistently points to a combination of things. Regular cardio exercise, absolutely. A balanced diet, especially cutting back on processed foods and added sugars, that's key. Getting enough good quality sleep. And managing stress effectively.
Sleep and stress, okay.
Yeah, they're crucial. Stress, for instance, impacts cortisol levels, which can actually encourage your body to store more visceral fat. So integrating all these habits, exercise, diet, sleep, stress management, that's how you make a real dent in visceral fat and lower your risk for all those related health problems.
What stands out to you listening here? It's such a powerful reminder that health isn't just that number on the scale. It's about where that fat is located and the profound impact it has, often silently, on your long-term health. A hidden factor, big consequences. Okay, building on that idea of smart movement, let's look at this next headline. It's from Health Magazine. This simple workout switch could maximize fat loss and strength gains. Feels like everyone's looking for that magic bullet, that ultimate efficiency in their fitness routine, right?
Absolutely. We all want the best results for our effort. And the insights from consumers' research here offer some useful guidance. When we talk maximizing fat loss, both things like high-intensity interval training, those short, intense bursts,
Right.
and traditional moderate-intensity cardio, both can be effective for reducing overall body fat. HIIT definitely has benefits like improving athletic capacity, glucose metabolism, but it's intense. Not for everyone, maybe not all the time. The common misconception, though, is often that cardio is just flat out better for fat loss, or that strength training is only for bulking up.
So it's not necessarily a simple either choice, or just HIIT is the best.
Not really, no. Research consistently shows you can't spot reduce fat. You can't just do sit-ups to lose belly fat, for instance. That's a myth. What's often missed is how much strength training contributes to fat loss, but indirectly. By building more muscle mass, you increase your resting metabolic rate.
Burning more calories even at rest.
Exactly. Your body just becomes a more efficient calorie-burning machine, 24/7. That's a really powerful, sustainable way to manage fat long-term, maybe more so than just relying on cardio.
That definitely shifts the perspective for a lot of us, I think. So how do we best combine these? If we want the best of both worlds, fat loss and strength, what's the smart way to structure things?
For the most comprehensive results, consumers' research suggests strategically integrating both. One really effective approach could be starting your workout with strength training. This gets your muscles activated, and it might deplete some glycogen stores, which potentially means you burn more fat during the cardio session that comes after. And just alternating between strength days and cardio days or combining them in smart ways, that prevents boredom too, which is huge for sticking with it. It really enhances both your heart health and your muscle development together. Plus, we're seeing cool tech now, like video-based systems that analyze your exercises using complex networks. They can help predict which muscles you're activating, making routines safer, more effective, maybe more accessible for people too, guiding you better.
So if we connect this all together, it really is about smart movement, not just moving for moving's sake. It makes you ask yourself, are you really maximizing your workout efforts for total fitness? Blending the strengths of both cardio and resistance seems like that synergy, that combination, is where the real payoff is. All right, finally, let's zoom out a bit to a broader societal topic, one that really touches all of us eventually. This headline is from Deseret News. Silver linings, breaking the code to age-related stereotypes, generation gaps. This one resonates, I think, because we see aspects of it in our families, our communities.
It's a really important conversation culturally, and the research offers some sobering thoughts here. Common stereotypes about older adults, that they're frail or dependent or can't handle technology. These aren't harmless. They actually have negative impacts on health and well-being. They fuel ageism. And that can lead to things like reduced access to good health care, less social engagement, even sort of a self-fulfilling prophecy where older people start believing these negative things themselves.
And these stereotypes often seem fueled by, the generation gap, right? Like we're not understanding each other.
Precisely. Misunderstandings between generations, they definitely perpetuate these stereotypes. Younger folks might see older people as maybe out of touch. Older generations might view younger ones as lacking experience or something. These misconceptions create communication walls. They hinder real connection. The research strongly suggests that things like intergenerational programs, efforts to foster open, empathetic communication, they can really help dispel these myths, build mutual respect.
That makes a lot of sense. But where does technology fit in? It often feels like a divider between generations, doesn't it? That stereotype of older adults being tech-averse.
Well, that's actually one of the biggest stereotypes that technology itself is helping to break down, which is fascinating. Modern tech is increasingly empowering older adults, helping them live more independently, stay connected, engage with the world. Think about smart home devices adjusting lights for safety, or health monitors tracking vitals and maybe alerting family or caregivers if needed. Even AI systems for detecting falls in senior living homes, they're significantly improving safety and quality of life, boosting independence.
Right, so it directly challenges that myth.
Exactly. It shows they can learn and benefit from new tech. There are even large data sets now, like one called CGOL. It helps researchers understand how these stereotypes, including age-related ones, vary across like 178 countries. That kind of understanding helps developers create tech that's more culturally sensitive and user-friendly for everyone, including seniors. Smart homes, with sensors monitoring mobility and health risks unobtrusively, they directly support older adults in living independent, active lives.
So what does this mean for you listening? It really isn't just about how we age individually. It's about how society views aging, supports it, integrates it. What role can technology, and maybe just as importantly, our own shifting perceptions play in creating more possibilities for independence, connection, a richer later life for you, for people you care about? Well, we have covered quite a bit of ground today on the deep dive. Wow, we navigated the tricky world of global pharmaceutical supply chains and how they touch your medicine cabinet. We explored how you can boost your own health with the surprising power of strength training and getting a handle on visceral fat. And finally, we looked at the bigger picture of aging, stereotypes, and how technology is actually helping redefine what's possible. Our goal here, week after week on the Deep Dive, is really just to bring you the most vital insights from all sorts of sources, help you stay truly informed without feeling overwhelmed. Thank you so much for joining us on this exploration of these important insights, all brought together by consumers.app. We really hope these nuggets give you a clearer, maybe more empowering view of some key consumer trends and how they weave into your life. And hey, if you enjoyed this, please do take a second to like, share, and subscribe to Consumers 360. It helps us keep bringing you these essential insights.
You know, this whole conversation really leaves us with a big but technology. Basically everything from our medicine to how we live, how we age, how much control do we as individuals really have over these huge global shifts. And maybe more importantly, what's up for you? But responsibility in adapting, yes, but also in actively shaping them for a better future for everyone.